Hello, it's Leah. Thank you for joining me today. And check out the cute flowers that my partner got me. Ooh. So today we're going to talk about something that is really important to me. It's how great my doctor has become over the years, how much better our relationship is than when it started. And I think the reason that I'm excited to share about this is because I really do believe in congratulating people for things that they do well. I really did kind of roast my doctor in the first video that I uploaded, and I really think that was merited for the time, but I have to really be clear, like, she is so much better now. She has really learned. She's really become a lot more open. We have a way more trusting relationship, and I really appreciate her now in a way that I wasn't able to before, just because she's really been so willing to learn. I think it's so important for us to appreciate that and draw attention to that and recognize that. Leading up to what will be my third hospitalization for diverticulitis, it's on the screen again because we're talking about that again today. January of 2025. So just very recently. The pain from my diverticulitis is usually in my left pelvis area, like lower left abdomen. I'd been having very, very, very minor pain every once in a blue moon since I had been discharged from the hospital in May of 2024. I had at the time my drain in the abscess that was in my abdomen, and it was basically draining any fluid, and it was sort of supposed to take care of itself. And then I had that removed in, I believe it was June. And so for about 6 months or so, I didn't really have any issues with the pain. And I thought, okay, great. It was a one-time thing. It's healed up. We're not going to have this problem anymore. Spoiler alert, that is not true. So I had gone back to sort of a normal everyday life. I was, back on just being able to eat vegetables again and stuff, because there was this weird period where they were don't eat any fiber. So I was eating my vegetables and all of my normal stuff that I would eat. And I got to about mid-January and I had started having discomfort in my lower left abdomen, right where my diverticulitis is. It was mostly this is not delicate, but it was mostly if I had to go to the bathroom and then I would go and it would feel better. So I thought, oh, okay, maybe it's just tender or something. I don't know, maybe it'll resolve itself. When I had realized that it wasn't really going away, I said to my partner, do we go to the hospital? Because it's not really painful. It's not super duper painful. It's just kind of painful. And it doesn't seem like it really merits a hospital trip just to get told that since you're not in pain anymore because it just came and went or something, that we have to discharge you or whatever. I just don't know if it's worth missing work and all of that stuff. And so we kind of decided amongst ourselves, okay, why don't we try the way that they did it in the hospital was taking me off of solid foods and giving my digestive system a rest and then putting me on antibiotics. So I said to my partner, okay, let's try liquids. We'll try clear fluids. We did that for a little bit. It sort of seemed a little bit better, but it didn't completely go away. So we went to the doctor. We went in to see her and she knew about sort of the history. She had seen the scans and things that the hospital had sent her. And so she was like, oh, okay. So she kind of felt around and she kind of asked me some questions and she was like, oh, okay. So it does seem like this could be the diverticulitis back again. And so I said, okay. And she's like, how did they treat it last time? I said, well, in the hospital, they had me on IV fluids for a while. And then when I was a bit better, they put me on clear fluids and then they put me on solid foods. And they were say, use a low residue, they call it diet, low fiber diet for the next few weeks and you should be good. But they gave me oral antibiotics when I left the hospital. She said, well, do you think that oral antibiotics will kind of take you over the finish line? Is that feasible? Because I think I've only ever heard of diverticulitis being treated in the hospital. I had said to her I'm willing to try that. And if it gets worse, I'll just go to the hospital. And it was sort of this really collaborative conversation. And it was so wonderful because that's really not how it had been before. I think over the course of the past year or so, maybe couple of years actually, since I had my sleep apnea that went undiagnosed for a long time and I was having seizures and stuff, you can check my first 2 uploads about that. I'll put them in the little card. Basically, she had been a little bit I think, shaken by the fact that she missed it, and that I had gotten to the point where I was like having seizures and stuff just from like oxygen deprivation when she could have just sent me for a sleep study like 2 years prior. It's really the kind of thing that gave her a lot more like faith in me, that it wasn't just that like I was a bad patient and I wasn't doing stuff right. It's that there was actually an underlying issue that she missed. I don't get the same feeling now when I go into the office and she like asks me questions and stuff. Like it almost felt like before she would be like, do you do such and such thing? And I would say yes or no. And she'd be like, sure. Like it almost had that like that feeling of it that she didn't quite believe me. And that's pretty much gone. And there's like a lot more trust in our relationship now. And it's been wonderful because she actually, this conversation where she says, do you think antibiotics will put you over the finish line? The fact that she's asking me what I think would be a good treatment to me is just night and day from how it used to be, because she's so willing to trust my judgment now in a way that she was not before. So for me, that was really, really beautiful. And I think I just wanted to have like, it's going to be a fairly short video, but I think it's really the kind of thing that we need to highlight, because people make mistakes, and really what defines us and like what helps us to become better is the learning process afterwards, right? Like she took that and she was like, oh boy, okay, she's really sick and this is maybe something that I could have caught. And if I hadn't been kind of like not seeing the forest through the trees, like if I had been able to sort of see her more holistically instead of just trying to treat her fatness, maybe I would have caught that, this seems like sort of a thought process that she went through, because I've just seen such a difference in the way that she's treating me as a patient, and just like generally the care that I'm getting from her has just been like night and day, and it's been so lovely. And yeah, I just really appreciate her, and I wanted to kind of recognize that. I don't want to say who my doctor is or anything. She's lovely, but like I don't think that that's appropriate, because it is like sort of personal information about myself that I'm not comfortable giving. What I will say is that she is a young doctor. She is a doctor that fits a lot of the demographics that the very same people who were trying to like pressure me into bariatric surgery in the hospital fit. So like she's young, she's female, she's very conventionally pretty, she's very like thin, she ticks a lot of those same boxes. And so there was sort of a similar attitude from both in the beginning. And it's so lovely to see that she's sort of been like, oh, actually, okay, like I think maybe this attitude is not helpful. Let's see if we can do better. I wanted to give sort of a shout out to my doctor, because I actually really love her now. That's all for today's video. It's going to be short and sweet, but I just wanted to give credit where credit is due. If you enjoyed this video, then please give it a thumbs up, a little like-a-roo. I do upload videos every Wednesday, so if you subscribe, you will get notifications if you hit the little bell. Yeah, I look forward to seeing you in the next one. Bye-bye for now.